Trump's dilemma. The Trump administration is at a dilemma. The president has one ear to the right-wing activists and media, calling on him to reopen the country swiftly, and another ear to some of his advisors, cautioning that the end of the lockdown and restrictions could exacerbate the pandemic.
Look, the president and his team, as well as governors across the country, are under a tremendous amount of pressure, not just to reopen the government, but also to protect American lives. I think the president said it very clearly that this would be one of the hardest decisions he has to make as president, is making that determination of how they best protect American lives, but also American livelihoods. And it's a very tough balancing act. I think the president is very smart to work with the nation's governors and provide states some flexibility, because what works in New York may not be what is best in Arkansas.
Since its early days, the Trump administration has been hardly functional, even when it comes to routine procedures related to running the country. No wonder that with the rising number of COVID-19 cases and deaths across the states, the White House is engulfed in confusion, partially emanating from mismanagement.
I don't believe this epidemic will change much in the eyes of Americans, nor in the eyes of the world, unless the Trump administration's economy changes dramatically. President Trump has either been liked or disliked in the eyes of Americans and in the eyes of the world. And the same will go for the world, but this may change if the mainstream media's views change of him. If the viewpoints of the world's media change, then the world's viewpoints may also change.
Amid the administration's highly criticized response, confusion in the White House was in part evident in the White House denial of President Trump's suggestion that Anthony Fauci, the government's top infectious diseases expert, may be fired. Trump had used the hashtag #FireFauci in a tweet, suggesting that such a decision may be in the making after Fauci indicated that more lives could have been saved if mitigation had started earlier.
You could logically say that if you had a process that was ongoing and you started mitigation earlier, you could have saved lives. I mean, obviously, if we had, right from the very beginning, shut everything down, it may have been a little bit different. But there was a lot of pushback about shutting things down back.
I like Dr. Fauci a lot, just so you understand. No, he's not here because we really weren't discussing what he's best at, but he'll be back up very soon.
Apart from infighting, the United States has indeed been one of the slowest countries to respond and was late in ramping up its efforts, according to Oxford University's Coronavirus Government Response Tracker. Amid the administration's poor response, the lives of health workers are particularly at risk. Reports suggest that the number of healthcare workers who have tested positive for the coronavirus is probably higher than the official tally. That, however, has failed to prevent some people, including some churchgoers, to observe social distancing.
Well, there are indications in some areas of local governments and police are arresting worshipers and parishioners for the want and the need to praise God. This will only serve as a major backlash from the American public if this continues. People will eventually push back and rioting and protesting.
U.S. government infighting goes further beyond the administration and Trump's inner circle, with the president locking horns with the state governors amid fears of a backbreaking economic recession. Although Trump backed down from pressuring states to reopen, his petty power play continues to cast its shadow on how U.S. states are run.
The plans to reopen the country are close to being finalized, and we will soon be sharing details and new guidelines with everybody. I will be speaking to all 50 governors very shortly, and I will then be authorizing each individual governor of each individual state to implement a reopening and a very powerful reopening plan of their state at a time and in a manner as most appropriate.
The most notable among all states dealing with the coronavirus is New York, where Governor Andrew Cuomo has been fighting with Trump over his scoreboard mentality in the midst of the pandemic. Trump is obsessed with reopening the country to make the economy look good in his favor. Certain U.S. states are themselves engaged in a bidding war against each other for personal protective equipment or PPE and medical hardware with skyrocketing prices.
Many Americans do believe in God. They do worship on a weekly basis, all throughout the week, not just on Sundays. Many Americans, maybe as many as 100 million, do believe in God and do worship and praise on a daily and weekly basis. If the local governments are pushing and trying to stop this worshiping, there will be protesting and rioting, and this will only serve to hurt local governments and state governments, and probably also the federal government.
On a global scale, the U.S. reputation is similarly hitting rock bottom. Thanks to Trump, the U.S. claims of leading the world are being debunked more than ever before at the time of a global crisis. The president's row with the World Health Organization has resulted in a halt to U.S. funding for the world body, which has become even more critical during the pandemic today.
Today, I'm instructing my administration to halt funding of the World Health Organization while a review is conducted to assess the World Health Organization's role in severely mismanaging and covering up the spread of the coronavirus. Everybody knows what's going on there. American taxpayers provide between $400 million and $500 million per year to the WHO. In contrast, China contributes roughly $40 million a year, and even less. As the organization's leading sponsor, the United States has a duty to insist on full accountability.
Cutting the fund due to the UN body's mismanagement has drawn widespread international condemnation, eroding the U.S. role in the global effort to mitigate the spread of COVID-19. With the U.S. absence, other superpowers such as China and Russia are trying to bring about global unity and coordination in combating the coronavirus pandemic.
We have people living today with minimal health care. When you have minimal health care, you don't want to go to the doctor often because it's going to cost you money. And the health care itself is very expensive, health care insurance on a monthly basis. All of this has to change, and change not only for the United States, but for the whole world and for the developing sector. We have to have a new economic system that puts human life above everything else. And that's what I'm working on, and that's what I'm advocating for the world, and especially for Africa.
Meanwhile, there are reports showing prohibition of large-scale gatherings being defied, which could worsen the spread of COVID-19. A protest by Trump supporters in Michigan against Governor Gretchen Whitmer's stay-at-home orders was one example.
This thing started at around 11 o'clock this morning, and it shows no signs of stopping. They wanted to clog the streets here, and that's exactly what they're doing. They're sending a message to Governor Gretchen Whitmer that they don't agree with her stay-at-home order. They say it goes too far, takes away their rights, and in some cases is too arbitrary. For example, you can go on a sailboat or a canoe, but not on a motorboat. You can't go to a second home if you live in the state, but someone from out of the state can drive to their second home in Michigan. And at big box stores, you can buy groceries and medicine, but there are certain areas of the store that have to remain closed.
Some Republicans and Trump supporters have publicly called on Americans to defy their local orders, arguing that they infringe on constitutional rights. This is while World Health experts are pointing to such restrictions as critical in efforts to slow the spread of the coronavirus. Experts advise people to stay at home as much as they can to avoid contracting the coronavirus, which would take its toll on the health sector. Yet, Trump and his supporters appear not to be taking such advice seriously. The anti-lockdown activists' mentality is reminiscent of anti-vaxxers and climate change deniers.
I believe Americans are very ready for this lockdown to end. Americans are upset from a total lockdown. There are indications many Americans are protesting this lockdown at the local and state government offices. Many believe it was too drastic of an action. For some believe the mainstream media and the Trump administration mushroomed the actual epidemic for alternative reasons.
Minorities hit hardest by the pandemic. Coronavirus cases and deaths in the United States are revealing the depth of the racial disparities in the country in an unprecedented fashion. Racial and socio-economic factors are playing a major role in the pandemic, but are being denied by U.S. authorities.
Everyone will be affected by this, but there are some communities and populations that are going to be affected even more significantly.
Dr. Uche Blackstock is founder and CEO of Advancing Health Equity in New York City.
The reason why we need to really discuss this issue and to collect the racial and ethnic demographic data on who is tested, who has the disease, and on who's dying from it is so that we can properly allocate healthcare resources equitably to the communities that need it.
Black and Latino communities are among the vulnerable ones hit hardest by the pandemic in a disproportionate manner. This is while most U.S. states have not even provided a racial breakdown of the number of COVID-19 deaths or cases yet. In New York City alone, the coronavirus is killing Black and Latino people at twice the rate that is killing white people.
We do not have the healthcare provisions and equipment and resources for the American people. And therefore, when people are getting sick, we are not in a position to fully help them as quickly as we should and as successfully as we should.
Racial inequality and its repercussions in the midst of the deadly pandemic made former President Barack Obama to highlight the issue on Twitter. The former U.S. leader called on policymakers to take action to protect the country's vulnerable communities. The long-standing inequality issues in the U.S. are once again taking their toll on the weakest.
There may and likely will come a time in which we have both an airborne disease that is deadly. And in order for us to deal with that effectively, we have to put in place an infrastructure, not just here at home, but globally, that allows us to see it quickly, isolate it quickly, respond to it quickly. So that if and when a new strain of flu, like the Spanish flu, crops up 5 years from now or a decade from now, we've made the investment. And we're further along to be able to catch it.
According to official figures, 33% of those hospitalized for COVID-19 are African Americans, who account for 13% of the U.S. population. Another example is Chicago, where we can see that African Americans, who make up only about 30% of the city's total population, are the main victims of the virus at nearly 6 times the rate of white residents.
Profiteering at the expense of human life has to end. And we have to have a new just economic order where the most important thing we do is secure the future of human beings and civilization. And that means making investments, large investments, before the crisis hits. Now the crisis hit, we should wake up, we should change, and we should embrace a new positive outlook of cooperation and collaboration around the world for the promotion of human life.
Democratic lawmakers have asked Health and Human Services Secretary Alex Azar to order his department to collect racial and ethnic demographic data on testing and treatment for the coronavirus. There were meanwhile fears of discrimination in the federally funded healthcare institutions as the virus was tearing across the states against minorities, including Asians.
We're getting inundated on a daily basis with hundreds of stories from people, either about their fear or about actual incidents of verbal assaults or physical assaults taking place. And this is happening everywhere. It's not, some people think, oh, it's just random in like podunk areas of America. No, this is happening in the biggest cities in New York, in LA, in San Francisco, Chicago, and around the world.
With millions of Americans applying for unemployment benefits, the coronavirus pandemic is brutally laying bare the extent of growing inequality in various aspects of life. It is no surprise that the poor are suffering from ramifications of the pandemic more than the rest of the nation.
The main problem is the shortage of funds. Over the last 30, 40 years, our elected leaders in the Congress, in the presidency, both Republican and Democrat, have actually shrunk our healthcare system. We reduced the number of doctors per 1,000 people. We reduced the number of beds per 1,000 people. We've privatized healthcare when it should have been in the hands of the public sector. We need millions of more hospital beds. We need thousands of more hospitals.
Of all the disparities created by inequities in the American society, healthcare may be the most inhumane one. Vulnerable communities have been grappling with unemployment and lack of healthcare access for generations. It's natural to see them have higher baseline rates of diabetes, heart disease, lung disease, and high blood pressure.
Well, it's no secret, Tony, that African Americans have a higher rate of things like diabetes, asthma, hypertension, those underlying conditions that we talked about that have led to the deaths of people with coronavirus. And because of that, one local health commissioner who calls racism a public health issue says she's taking the lead by collecting important information that she says could help save lives.
We're in the middle of the storm right now. We need as much data as possible. Right now, we're flying blind.
Regardless of the pandemic, chronic conditions already attribute to a lower life expectancy among the marginalized members of the society. Socio-economic reasons such as not being able to work from home, having to use public transportation, or living with multiple people also increase the possibility of contracting the virus.
The difficulty is if people have low-paying jobs, if people don't have adequate health care, and if people have underlying conditions from their conditions of life, such as hypertension, high blood pressure, etc., all these contribute to making it the individual more susceptible to catching the virus. But again, the question really is, can we upgrade our entire economy and world economy? Establish a new economic platform of physical economic production and also of healthcare, not just for the United States, but for the entire world, because as long as the virus exists anywhere, the entire human race is in danger.
While differences in income and race are proving to be deadly in the wake of the pandemic, the virus is also disproportionately harming inmates in U.S. prisons. Alarming conditions at American jails have put prisoners on edge, occasionally leading to riots that are brutally suppressed by corrections authorities.
Well, inmates at the Lansing Correctional Facility are back in their cells this morning after a disturbance in one of the sections there.
It came on the same day numbers of confirmed cases of COVID-19 there rose to 12 inmates and 14 staff members.
So this morning, 41 Action News reporter Charlie Keegan is live outside the prison to explain what's happening right now. Charlie?
Lindsay, it looks like everything's calm here inside the prison behind me. We've been camped out, Bo, for most of the overnight hours, and I want to let you know that we saw dozens and dozens of cars leaving the parking lot here of the Lansing Correctional Facility throughout those early morning hours. A lot of those people driving the cars were wearing, police-style uniforms. One person told me that everything is good and back to normal inside. I have reached out to the Department of Corrections for an official update this morning, but we're still waiting to hear back. All indications, though, is things are back to normal. We even saw a food delivery truck come here just before 6 o'clock this morning. Now, I want to get you to some video from over yesterday when we were keeping track of this disturbance. You could see what was going on inside, and we actually got a hold of an inmate in there who told us that a lot of what's happened in that uprising was the fact that the inmates there were kind of upset with how the prison was handling COVID-19, and that kind of leads to a larger question about prisons and protecting prisoners from COVID-19. That inmate told us that the prison, Lansing here, had moved infected prisoners to the infirmary near cell block C, and those people in cell block C were worried they weren't getting the right masks to protect them from the coronavirus.
This is why little or no efforts are made by corrections officials to address the outbreak amid fears that correctional facilities are serving as petri dishes in the pandemic. Amid the growing fear among inmates over the spread of the deadly virus, prisons are grappling with COVID-19 as the number of cases and deaths officially reported are on the rise.
You have to have the full array of resources available. And unfortunately, the United States, in the recent, let's say, 40, 50 years, the focus has been on Wall Street making money and speculators making money and a small group of people making money. And therefore, money and profit and individual wealth has been put on a higher level than human life. And therefore, we have to go back to the actual notions we had under Roosevelt, President Roosevelt, Franklin Roosevelt, and President John Kennedy.
While some U.S. politicians, mayors, and governors are calling out the health disparities, there are concerns that resources may be prevented from flowing to the communities most ravaged by the pandemic. Racial and ethnic disparities have always been a part and parcel of the American society from its nascent days, but today they could harm the weaker portion of the society like never before.
With the crisis the COVID pandemic has brought to light is the failure of our current economic system that's been governing us for the last 40 or 50 years. That is maybe one underlying point that we can build on. The system doesn't work. If you have a system run by financial elite who are only concerned about their profits, then people will die.
The coronavirus outbreak comes at a time when an openly racist president is in office. The Trump administration has been criticized from the get-go for its policies against Muslims, African Americans, Hispanics, and other minorities in the United States. With the COVID-19 death toll on the rise, human rights activists in the country must be ever more alert to call out racism.